Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush.
Hello, everybody. Welcome to our podcast. We're so happy to have you again. Thanks for tuning in. Mark, how are you doing out there on the right coast?
I'm doing fine, sir. We're finally getting a little bit of fall weather.
Well, good.
Yeah, leaves aren't changing yet, but it went from 1,000 degrees and 1,000% humidity to 60 and driving windy rain. So,
oh, good.
Yeah, it's
good.
kind of typical.
Well, yeah, you're getting buckled down for winter. Should be.
Well, no, not yet. Still got a whole quarter of the fishing season left.
Oh my gosh, that's right.
Yes, no. Shh, don't say that. Don't say winter.
Yeah, sorry, I blew up.
Okay, all right.
I'll go to my room. What we're talking about today is marketing implants without actually asking for implant patients.
Right. How to get implant patients without asking for implant patients.
Yeah.
Right. This is going to sound like...
Sounds weird.
Yeah, like it's a secret.
Yeah.
And it is, honestly.
It is, yeah.
But we're not the kind of guys who have these podcasts that say, discover the 7 secrets of implant patients. We're going to leave that to the other 13,000 marketing companies that are trying to get your attention.
It used to work years ago.
I know. I'm just going to wait for them to catch up on it.
Yeah, okay.
Anyway. Okay, so how to get implant patients without asking for implant patients. So let's look at the consumer first. Then we're going to go through the methods of attracting implant patients. So let's talk about the consumer first. I would agree, and we would agree, that more people, consumers, have heard the term dental implants this year than 5 years ago.
Oh, most definitely.
Right. There are people out there who are advertising.
Absolutely. Big, huge, full-page ads in the newspapers.
Yep. And TV.
And TV.
Clear Choice, if you're near a Clear Choice center. People are starting to see, or at least become familiar with the term dental implants. They don't necessarily know what it means. They don't know what it is. They don't know how you do it. They just heard that it might be a solution to some of their problems. So it's sort of like the old days before the clear aligners, when, straighten your teeth without braces was, nobody knew what the hell that was, right?
Right.
I started advertising it, and pretty soon it got branded Invisalign. And, now most of America knows what Invisalign or, clear aligners are. So, having said that, the consumer really comes at this from 2 different angles. And it's really important for everybody to understand and go back to our previous lessons about the difference between passive and aggressive marketing. Passive marketing waits for the implant patient, either a patient that has seen that TV or full-page ad and is just looking for the first dentist to look at them and see if they're a candidate for dental implants, or, and this is the other side of the equation, the previously diagnosed and treatment planned shopping implant patient.
Yes.
Okay. 2 very different human beings right there. Okay. All right.
Yes.
So normally, if you're going after the previously diagnosed and treatment plan dental implant patient, you're doing so online because you know that previously diagnosed and treatment planned implant patient is now doing what? They're shopping.
They want a better price than what they were quoted.
That's right. They want the solution. They were shocked at the price. So they type in dental implant dentist near me, and up comes however many ads for dental implants. Those are the patients you're going to see and you're going to get there. Now, there's a whole other part of dental implant patients that pretty much, I'm not going to say they're ignored, but I'm going to say largely ignored. And those are the dental implant patients who have just learned about dental implants. They don't really know what they are, don't know how it's going to help them. They don't even know if they're a candidate for it. They may not even know anybody that might be a candidate for it, but they just heard the word dental implants on TV, radio, billboard, whatever. Maybe even online. They saw in an ad on their Facebook or something. Okay. So you get to those people, you get them to want the benefits of dental implants without asking them. And the way you do that, in other words, it doesn't do any good to go to that person and say, do you want a dental implant? They haven't been diagnosed yet. They don't even know what problem an implant solves.
Yeah.
They just know they're familiar with the term dental implant. Okay. Here's a key point. They may not know that a dental implant could solve their mom's problem with her slipping dentures.
Right.
That's
exactly.
Right. Okay. So what do we have to do? How do we, me, the dentist, how do I become the gatekeeper in this decision? And the answer is, well, you just educate them. You show them, you give them all the benefits of dental implants. That's how you get the interest to come to you. Before they go to a different dentist, get a different diagnosis, a different treatment plan, and then they turn into a shopper, go to Google, and they hit one of the sponsored ads that says dental implants, $19.95, including the crown.
Right.
I'm sure if you type in dental implant dentist near me into your browser, an ad like that is going to show up.
It sure will.
Okay. Because all your dentists are competing for the same online in a passive environment. They're basically all competing for the patients who have a real or perceived need for dental implants right now, largely many because they've already been diagnosed and they're shopping. Okay. What we do is we go after those too. We have plenty of clients that do online implant search engine marketing with tons of them. But the whole other side of the equation is going after the right people.
Yeah, becoming aggressive instead of passive, right?
Exactly. Thank you, Howie. Is doing both. It's the same thing we preach all over the place. You have to do both. Well, if you're going to have a robust implant practice, you have to reach out to the community and explain to them how many benefits are there to dental implants. My goodness. I mean, there's filling a gap in your smile. There are the cosmetic aspects of dental implants, the bite aspects of dental implants, the denture and anchor aspects of dental. How many?
The amount of anger people have over dentures. You just tap into that with implant as a solution, and it's like a fountain going off down at the Bellagio.
Exactly, exactly. Right. So
they hate their dentures.
Right, but we're not asking them to buy a dental implant, are we?
No.
We're simply identifying a problem they already have and offering them a solution to a problem they already have. Because you're the one who wants to diagnose them. You're the one who wants to treatment plan them. You're the one who wants to present to them the solution you provide, right? But that consumer isn't going to tip over and want an implant until they have a real or perceived need. And the way you do that is to introduce new information in front of them. That new information you provide, you control. You even control who sees it. And you control the quality or the targeting of the person who sees it. You can do that through mail. You can do it through Facebook. You can do it through basically those two media types. Okay? That's how you get implant patients without asking for implant patients.
Right. And that's a good place for us to take a break, because we'll come back to this subject and delve into it a little deeper in a minute. So don't go away. We'll be right back. Hey, Mark, we should tell people about this new product we have, NPI Command.
Well, probably new to the podcast listeners, but not new to the customers who use it. So let me go through the finer points. NPI Command is a system we use. It's an artificial intelligence system that creates decisions on where dentists, our clients, should put their pay-per-click money when they do Google pay-per-click ad campaigns. If you're someone who's already done them, then you're probably frustrated by the cost of the negative clicks. Well, if there's an artificial intelligence platform monitoring your negative clicks, you can see immediately how doing these on an artificial intelligence platform will allow for a faster build and the faster allocation of the advertising money to the places that are bringing in good clicks. Because with every PPC campaign, there's sources of bad clicks and sources of good clicks. And the whole idea is to throw all your money in the good ones and pull your money from the bad ones. So NPI Command is our PPC department. And it's not just a department of humans, it's an artificial intelligence platform as well.
Okay, we are right back. We're talking about how to get implant patients without actually asking for implant patients.
Right, right. which is really, so I was on a consult with one of our really nice clients, been with us here for a while, doing really well, down in Texas. And we went through an initial analysis for NPI, Command. It's the Google AdWord campaign. And he just wanted to see if it was worth, going after the implant market on Google AdWords as a media type. And he's in a very competitive environment in a suburb of a big city in Texas. And, initially I thought, you might be bringing a knife to a tank fight, but let's take a look. So we took a look, and sure enough, Implant popped up as requiring the largest budget. But that's because we were going to bid on keywords and phrases for implants. Now follow along, okay? What if we bid on keywords and phrases for dentures?
Yeah, slipping dentures even.
Right. Sedation dentistry. What if we bid on those keywords and phrases? What if we bid on everything but implants, but everything that supports the benefits of implants, right? What it ended up doing is consuming half of his budget. Okay? And if you know anything about Google AdWords, here are some, it's just math, okay? If you're in even a reasonably competitive environment, and you understand that Google AdWords or search engine marketing in general is really there in a passive way. In other words, it's only going to show your ad to someone who's searching for what you're selling. And add to that, you're in a bidding process. You might as well assume Google AdWords is not going to get less competitive. You might as well assume it's going to get more competitive. And when you're in a bidding process for keywords and search terms, a bidding process means that your costs go up. We don't really anticipate that the search for dental implants or dental implant related search terms and words is going to increase exponentially. So the number of people looking for implant type of procedures in your given market, it's going to grow, but it's not going to grow beyond your ability to pay for it. So basically, here's the bottom line. If you're in a bidding process for I'm not going to call it a finite set of terms, a set of search terms or phrases, but I'm going to call it restricted. If you restrict your terms and phrases, and you're in a bidding environment for those terms and phrases, and more people come into that same bidding environment, the only thing that can happen to you is that your costs will go up and your results will either stay the same or go down. And that's okay if you know it going in. Now, here's how you offset that. Okay. You get implant patients without asking for implant patients. Okay. You stop bidding on the same thing that Dr. Schmo down the street is bidding on, and you start bidding on other things. Get the patients in your door to a solution which ends up being an implant, but gain the exposure based on a different problem they may have, like slipping dentures or just dentures.
Yeah, hate your dentures.
Like, how many dentists that are listening to this right now, let's say their mom came to them and said, honey, I'm losing all my teeth and I want to take care of this and get it done once and for all. What should I do? How many dentists listening to this would offer to their mother a denture with no implants? The answer is probably none.
Yeah.
Okay. So
not if they still wanted a good relationship with their mother.
Right. Let's assume Let's assume you want to maintain a good relationship. So do you get my point?
Yeah.
Okay, now you can do this with Google AdWords. You can do this with Facebook. You can do this especially with mail. I can't tell you how many senior mail campaigns we have going on it's got to be in the hundreds. I don't know how many we have going on right now, but that you have to introduce new information to the right people in your market, drive them to your website. And if you want to use Google to trap the people who are already diagnosed, you can, but you're in a bidding war. So if you don't have the budget to be part of that bidding war, you can still go after those implant patients without asking for those implant patients. Does that make sense?
Yeah, it does. You can target just if all you did was target by age, you'd hit some good targets out there because, of course, dentures and implants are the older crowd.
Right.
So that you add that select, it's called, to your mailing demographic, and you don't have to target any more closely or seriously than that. It's actually kind of easy. As long as you explain, the benefits correctly and in a way that will communicate to people, and the light will go on in their head. Oh yeah, that's a solution for my problem or my husband's problem, and it involves an implant.
Right. Now, the last part of it is how to get implant patients without asking for implant patients. Part of this is communicating with your own patient base.
Oh, yes.
Because your own patient base, even if they're 35 or 40, and they're not really a candidate for implants, they may not be for another 10, 15, 20 years. But their parents might be. Someone they know at work might be. Right? So you're not necessarily asking your existing patient if they're a candidate for implants, but do they know someone who struggles with their dentures? And you'd be surprised how many daughters go, my mom complains about her dentures, or my dad complains about his dentures every day. I'm tired of hearing it.
Yeah.
Right? And all of a sudden, you have a direct internal referral, which is gold, of a new patient who could be a great candidate for dental implants, right?
Yeah.
So it's not always about external.
Yeah.
You don't always have to ask the person you're going to give or you're going to provide the implant for. You ask their daughter or their son, you may end up with a whole bunch of more dental implants. Do you know anybody who wears dentures? How hard of a question is that?
Yeah, exactly. Mark, this is something that we discovered a long time ago. And it goes beyond this subject matter. Where are all the cosmetic patients? Where are all the big cases?
Right.
Where are all the implant? You know where they're at? They're in your patient base right now.
Right.
Maybe they've been there for a few years. That's where the big cases usually come from. You go out, and we learned that years ago when trying to advertise for cosmetic patients.
When everybody in the world,
that,
right?
you don't get
in the world had endless funds.
Yeah,
yeah.
Go out and ask for it. You don't get it, but if you go and present the subject to your own patient base, then in time they will come around.
Absolutely, and those you have engaged on your Facebook page too.
Exactly.
It's you get disappointed. Oh man, I posted and boosted the post last week, and I didn't get anybody, jamming my door down, on a Thursday morning, demanding that I do an implant on them. That's not how it works. Just educate in the right way, in the right format, in little bite-sized chunks, multiple times, and you can manipulate an entire market. And that market might be your existing patients, and the market might not be your patients at all. It might be the general public, or it might be a targeted section of the public, or it might be just people who do a Google search for implant. It could be any number of one of those segments. But here are the takeaways. You don't have to ask for implant patients to get implant patients. Yeah. Okay, that's one of the takeaways. Okay, it's kind of obvious because that's the title of this podcast. Okay. Another takeaway is further understanding the difference between passive and aggressive, and understanding that passive, if they're doing search on a search engine, there's a really good chance they're shoppers. So understand what you're getting and what your ad is going to have to say, and how you better prepare your staff too. Okay, because these people are going to say, "Why isn't your implant $19.95?" Because I just came off of another page that said $19.95. Okay, so understand what you're getting into when you promote passively to a shopper audience. On the flip side, understand that you can create your own audience that aren't shoppers. You can become the gatekeeper. You can become the person who does the exam, who does the treatment plan, and doesn't allow that person. I'm going to say doesn't allow, but I'm going to say convinces that person that you're the right solution to their problem while they're in your chair. It's better than getting them after they've been in somebody else's chair.
Yeah.
Okay. So that's what, if you're struggling, right, with implant promotion, take these tidbits out of this podcast and just formulate them in your mind so you understand what you're up against. Understand exactly what you're doing if you're advertising at all. If you're not advertising at all, then we just gave you a 15-step head start in getting more implant patients.
Well, all right. That'll wrap things up for today. Thank you, Mark, and enjoy your time up in Maine.
Yeah, I'm closing it up. It's a sad time of the year.
Sad time of the year, but
I know.
There's always next year.
Yeah.
And to all of you out there listening, we sure appreciate it. Thank you, and we'll be back next week. Bye now.
We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and newpatientsinc.com.